The British government has unveiled a new vaccine research facility where scientists are working to prevent future pandemics. It's located at Port and Down, a high-security research facility best known for its work on chemical warfare. Experts are preparing for what is known as Disease X or the next pandemic virus. Our health correspondent Dominic Hughes was given rare access to the facility, the delicate task of protecting the nation's health. This is one of the laboratories at Port and Down where scientists are analyzing current threats, new variants of COVID for example, and trying to identify new ones. Inside these purpose-built labs, more than 200 scientists working for the UK Health Security Agency are helping to develop and test vaccines against a range of diseases. It's vital work to keep us all safe. We've got in many respects the toughest them during the world, which is to protect health against infectious diseases and environmental hazards. And it is tough because we know that the risks of new and emerging infections, including those of pandemic potential, is increasing. For decades scientists at Portendon have been involved in medical research as well as the work on chemical and biological warfare, for which the center is perhaps better known. During the pandemic, laboratories like this one played an absolutely vital role in assessing how effective the vaccines were in combating the coronavirus, and that work continues today, but as well as monitoring how effective existing vaccines are against new COVID variants. The new vaccine development and evaluation.
We're on the very issue of Disease X. I've been speaking to Professor Dame Jenny Harris. She is the Chief Executive of the UK Health Security Agency, and I asked her how scientists prepare for a threat when they don't know what that threat is. So that is the challenge, which I think you heard our Chief Scientific Officer Professor Isabel Oliver describe. But there are a number of steps that we can take. We can be better prepared in terms of surveillance, and we're doing that work separately. But what we do in the UKSA labs at Putting Down, which is separate, I might say, from the Ministry of Defence facilities for chemical warfare, is get ourselves ready both to isolate the new pathogens, to develop assays so that we can test them accurately, and to work with other partners, with academics and with pharma.
So I think I was going to say partnership was the immediate work that comes to mind, and that obviously we see that when we work with our Director of Public Health, for example, in responding to all sorts of infectious disease and chemical and radiological incidents, but actually it applies very much to working with industry as well. The Vaccine Task Force was the group which originally supported this investment in laboratory space at Putting Down at the UKSA site there, and it is that continuing work which we are planning to continue going forward, so that we are ready, working together as soon as a pathogen appears, and actually obviously beforehand. So we're prepping as fast as we can. There is that target of being able to deploy hopefully